Cancer is the second leading cause of death in the world. It is a disease that develops when cells in your body divide at a faster rate than normal. These abnormal cells have the ability to infiltrate and destroy normal body tissue. They can grow into a lump or tumor. Tumors can be either benign or malignant. Benign tumors tend to stay in one place without spreading to surrounding tissues. Malignant tumors grow and may cause new tumors to develop in other parts of your body. Any factor that could lead to an abnormal body cell's development is a potential cause of cancer. Several factors contribute to the development of cancer in your body, smoking and using tobacco products being one of the main causes. Most signs and symptoms of cancer can be brought on by various factors rather than cancer itself. If you have any signs and symptoms that don't go away or get worse, you should see a doctor to find out what's causing them. Cancer does not always present with symptoms. However, early cancer detection saves lives. Even if you have one of the following symptoms, you might not have cancer. However, to be safe, consult your physician. Here are some of the more common signs and symptoms that may be caused by cancer. Unexplained weight loss or weight loss without trying. Nearly 50% of cancer patients experience weight loss. It's often one of the signs. Small weight changes over time are perfectly normal, but if you significantly lose weight without trying, consult your doctor. Fever. When you have a fever, your body temperature rises above 37.5 degrees Celsius. Fever can be a common symptom of colds and the flu and clears up on its own. Most people might not visit the doctor's office when they have a fever. Fever, however, could indicate an infection in a cancer patient, who would then need immediate medical attention. If your fever only occurs at night or if it's high or lasts more than 3 days and doesn't seem to improve, you should pay close attention. Drenching night sweats. Sweating is your body's way of lowering body temperature by causing heat loss through your skin. Infections or the side effects of certain drugs may be the cause of nighttime sweating. Around the menopause, it is also often experienced by women. When cancer causes a fever, your body may sweat excessively as it tries to cool down. This kind of sweating is often heavy and drenching and is usually accompanied by 2 other symptoms, which are fever and unexplained weight loss of more than 10% of body weight over 6 months. Collectively, these 3 symptoms are known as B symptoms: fatigue or extreme tiredness that doesn't get better with rest. There are several reasons why you could feel more exhausted than usual, especially if you're dealing with a stressful situation or are having difficulties sleeping. Extreme tiredness that does not improve with rest may be a sign of cancer. Cancer uses your body's nutrients to grow and advance, so those nutrients are no longer replenishing your body. You can feel incredibly exhausted as a result. In the event that you have fatigue for no apparent reason, consult a physician right away. Unusual lump or swelling anywhere in the body. It might be worrisome to discover a new lump or bump, but it's important to keep in mind that there are other conditions other than cancer that can cause masses to develop on the skin's surface or just below the skin. Numerous factors, most of which are harmless, can cause lumps to grow on the body. Although the likelihood that it is malignant is the main worry, it might also be a sign of tendinitis, rheumatoid arthritis, or a large lymph node. Bumps that are cancerous are typically large, hard, painless to the touch, and appear spontaneously. The mass will grow in size steadily over the weeks and months. Cancerous lumps that can be felt from the outside of your body can appear in the breast, testicle, or neck, but also in the arms and legs. Regardless of where they are, lumps that are larger than 2 inches and large or uncomfortable should be discussed with your doctor. Report any new lumps or other symptoms to your doctor if they cannot be explained or persist for more than a few weeks. Pain, especially new or with no known reason, that doesn't go away or gets worse. Pain is one way our bodies tell us that something is wrong. Having cancer does not always mean having pain. It can be brought on by a wide range of medical conditions, the majority of which are not cancer. Most cancer pain is caused by the tumor pressing on bones, nerves, or other organs in the body. The chemicals a cancer releases in metastases or spreading from where a cancer started. Your doctor can advise you on the best course of action if you are dealing with persistent pain for which you have no idea what the cause is. Never consider suffering from pain to be a typical aspect of having cancer. It's critical to keep in mind that all pain is treatable. While there may not always be a full recovery from cancer pain, your doctor can work with you to manage and alleviate it as much as possible. Skin changes. Although skin changes are a natural aspect of aging, they can occasionally serve as early indicators of developing medical issues. Check your body for any new or strange moles, bumps, or marks to be sure skin cancer isn't developing. Be aware of any new moles or existing moles that change in size, shape, or color, become crusty, itch, hurt, bleed, or ooze. Your doctor should be consulted if there are any strange changes in a patch of skin or a nail, regardless of whether they are recent or have been present for some time. Changes in your poo or pee. If you've observed a change in your bowel habits, are having trouble urinating, or if there is blood in your poop or urine, let your doctor know right away. Constipation, looser poop, or more frequent urination are examples of changes in bowel habits. Peeing issues can include the urge to urinate more frequently or urgently, pain when urinating, or inability to urinate when necessary. Unusual breast changes. All breast changes, including lumps, should be reported to the physician. Watch out for any changes to the skin, redness, or soreness in the breast, as well as any changes to the size, shape, or feel of the breast. Additionally, if you are not pregnant or nursing, pay attention to any changes to your nipple, such as fluid leakage that may be tinged with blood. Voice change and coughing. Colds frequently result in croaky voices and hoarseness. However, a croaky voice that hasn't gone away by itself has to be examined. Similarly, coughs are common with colds and some other health conditions. But if an unexplained cough doesn't go away in a few weeks or gets worse, it could be a sign of cancer. It's normal to experience occasional breathing difficulties. But if you notice that you're feeling out of breath more frequently than normal or all the time, let your doctor know. Bleeding more often. Unexpected bleeding should always be reported to your doctor, even though it may frequently be brought on by something far less harmful than cancer. This entails passing blood in your poop or urine, as well as vomiting or coughing up blood, regardless of how much or what color it is. Any inexplicable vaginal bleeding during sex, after menopause, or between cycles is also included. Mouth ulcer that won't heal. When you're feeling a little under the weather, it's common to develop oral ulcers, which usually heal in 2 weeks or less. However, you should notify your doctor or dentist if an ulcer or a red or white spot does not go away after 3 weeks. Changes in appetite. Loss of appetite is called anorexia. People with cancer often notice changes in their appetite. People with a very low appetite that lasts more than a few days usually lose weight. Losing weight from not eating enough can often make a person feel weak and have fatigue. Some tumors release specific hormones that have an impact on how the body detects hunger. A person's appetite can be decreased by conditions including pain, stress, despair, dehydration, and nausea that could be caused by the cancer itself. You may feel full or find it difficult to eat if you have ovarian cancer. Other cancers might make you feel nauseous or sick. A doctor should be consulted if you have had problems eating for more than 2 weeks. It should be noted that cancer is not the only illness that alters appetite. Anemia. Anemia is when your body's level of red blood cells goes below normal. You can develop anemia if your body does not make enough red blood cells or destroys them. You can also develop anemia if you lose too much blood from your bloodstream. It is the bone marrow that produces red blood cells. Bone marrows are found within your longer bones. Your body is signaled when to produce more red blood cells by the hormone erythropoietin, which is produced in the kidneys. Damage to either the bone marrow or the kidneys can cause anemia. Anemia is a common condition of cancer patients. This is because inflammation brought on by cancer reduces the synthesis of red blood cells. Certain types of cancer like leukemia, lymphoma, and multiple myeloma damage bone marrow. Also, other types of cancers that spread to the bone or bone marrow may crowd out healthy red blood cells, limiting their production. On the other hand, since the kidneys produce a hormone that spurs the bone marrow to make red blood cells, if a patient has kidney cancer, he or she could develop anemia. The signs and symptoms we've discussed thus far are the more typical ones associated with cancer, but there are many more that are not included here. Inform your doctor if you experience any significant changes in how your body functions or how you feel, particularly if they persist for a long time or become worse. And we've reached the end of this video. If this video has been helpful, give us a like, share it, and subscribe to our channel. Thank you for watching. Until next time.